Hey everybody! Today we're talking about how to deal with fibroids during pregnancy. I'm Dr. Perkins, a board-certified OBGYN. I'm so glad you are with us today. Let's dive on in. So by the end of this video, you'll know much more about fibroids and what they are, the impact of fibroids on pregnancy, and in fact, I'll give you 5 common symptoms that you should know. You'll know how to monitor fibroids during pregnancy, and you'll know what exactly you can do if you have fibroids in pregnancy. So let's talk about it. So what exactly are fibroids? You hear this term all the time. It's been thrown around everywhere. People have them, they don't have them, they have issues with them, and you're just like, I have fibroids too, and either planning pregnancy or are pregnant. And so I want to know more about them. And so guess what? You're in the right place. So let's talk about what fibroids are. So first, I'd like to mention that fibroids medically are not called fibroids. Okay, this is a social term that I'm actually not sure where we got it from, but the term medically is a leiomyoma. And I guess fibroids is just much easier to say than leiomyoma, but that's the clinical medical term. So you may notice that in your records, in your my chart, whatever you use for your medical records, you may see leiomyoma or a myoma. And so for the sake of this video, we will say fibroids. But if you hear leiomyoma, you know exactly what we're talking about. So what are they? Well, they are a non-cancerous growth. And I'm going to say that, but I'm going to put a pin there at the same time because really 98 to 99% of them are non-cancerous. But there's a very small subset of fibroids that could be cancerous. And so while we want to be comfortable in thinking that these are non-cancerous, it is very important that you keep up with your medical provider who will kind of guide you on whether or not the fibroids you have are really truly non-cancerous or if they are at risk of being cancerous fibroids. And so they're called a non-cancerous growth in the uterus. They are actually very different from the uterine tissue. So I'm going to pull out my model here to kind of give you an idea of what happens with fibroids. And so this is a model of the uterus, which we can see here, okay? This is the vaginal space. These are your fallopian tubes and your ovaries. You have 2 on each side. Fibroids are commonly found inside or on top of the uterus. If we were to look in a little bit closer here, we're seeing the muscular area of the uterus. And fibroids can be found there on the inner space here, or even on top of the uterus. They can also hang off of the uterus, almost like a fruit hanging off of a tree, all right? So they can be somehow attached to the uterus or inside of it. It's important to know the types of fibroids that you have, where they're located, as well as the size. I'm going to show you an example of what fibroids may look like. This ball here represents a fibroid. And so this one would be about 6 centimeters in size, all right? Now, they can be much smaller like this. They can be in between like this one. And so know that they all start from being a small little tiny cell. Really, really microscopic, and they can grow to be even bigger than the one that you're seeing here. In fact, I have a fibroid, and my fibroid is about twice the size of this one, okay? So if you're dealing with them, I know exactly what you're going through. So now let's talk about some of the symptoms that you may experience with fibroids. The first is that you may have heavy bleeding, okay? This is on your menstrual cycle. Your bleeding may just come consistently. It may last longer than 5 to 7 days. You may have to change your pads like every hour. Now, none of these things are normal or typical or what should be, but they may happen. The next is that you may start to feel a lot of fullness in your lower pelvis, just feeling like you're bloated all the time or feeling like you have a lot of weight there. That is because as the fibroids are growing and growing and growing, they may fill up your pelvic space, and you'll feel that fullness and that pressure in that area. At the same time, you may also notice that you're growing almost as if you are pregnant, and you're not pregnant, but you're growing from the growing fibroids in your uterus and in your pelvis. So you may notice a little bit of an enlargement in that area as well. Two other symptoms that I'd like to mention here is that you may also have a lot of frequency when you're trying to urinate. You may feel as though you always have to go, or even if you do urinate, that you haven't emptied fully and you have to go again. And so urinary frequency is another very common symptom. And lastly, I'd like to mention that you may have pain with sexual activity. And so sometimes you can have pain with sexual activity for a lot of different reasons, but especially on deep penetration, if you have fibroids, you may have a lot of pain. So now the topic of our video is really how to deal with fibroids in pregnancy. Let's talk about the impact of fibroids on pregnancy. In early pregnancy, 5 to 6 weeks, maybe 7 weeks of pregnancy, if you experience any bleeding, sometimes that could be due to having fibroids. If you're like me, I didn't know that I had fibroids until early pregnancy when I started having a lot of pain and some bleeding as well. And this was right around the 6-week mark. And so when I had an ultrasound, which is exactly what you should do in this instance, we found out that there is this massive fibroid that is in my pelvis fighting with a growing pregnancy. And so one of the risks is that you may have a miscarriage, or your pregnancy may have trouble developing inside of the uterus because there's a fibroid there fighting with it, stealing the oxygen and the blood flow that is important to the growing pregnancy, but stealing it for itself. And so miscarriages are a huge possible complication because you have fibroids in pregnancy. Now, if you're able to move beyond that early point in pregnancy, so you're no longer in the first trimester, maybe you're in the second or the third, there are other risks as well. Some of those risks include the possibility of a preterm labor or delivery. It is the risk that your baby may not be in the correct position when it's time for birth. It could also mean that you may have unexpected bleeding that lasts throughout the third trimester, that can go throughout your delivery, or even postpartum for a few weeks after you deliver your baby. While we're still diving into this topic, we've covered a lot, but there's so much more that I'd like to mention. So this is what we're going to do. We're going to make this into a part 2 video. So join me on the next video. You'll see the link down below in the description, and we're going to talk more about what to expect and how to truly deal with fibroids in pregnancy. Thank you so much for listening in so far, and we'll see you on the next video. I'm Dr. Perkins, a board certified OBGYN, and as always, it's a pleasure to have you here with us.